Hi friends, I'm Joel John from Joel John J YouTube channel. Now I am sharing the screen and this video is going to be an introduction for medical coding process and how the services functions, what are the process, how the audit happens, what are the different types of CPT codes, what are all the certification which are most valid, and how the process flow works, and how important it is on denial management perspective. Everything we are going to discuss on this. And for AR and denial management people, these are CPT and ICD codes mainly, which you see or which you hear when it's talk about medical necessity, or what are all the procedures which are denied, they will give the CPT codes. And when you talk about medical necessity, it will be with the ICD-10 codes, and adding modifiers and all those things are done by the or the CPT codes, ICD-10 codes, modifier adding to the doctor notes are done by this medical coding team for your understanding. And what the denial codes you get, the reason codes and the common denial codes you get, the CO codes, are all given by the insurance claim adjudication team. So that's a difference. There's a great difference there. So understand that, and this is for the understanding of medical coding team as well, because they should know about that. And regarding that, we will speak in detail on the future videos. And now, if you are interested in medical coding, if you are a fresher, if you are a life science graduate, you can join even without a certificate, and there are companies which give opportunities. And if you are not a life science graduate, it's hard to get a entry as a fresher in medical coding sector, but there are small companies which still recruit and train them. And also there are companies which recruit life science graduate, and they themselves make you to appear for the certification exams, because when they give outsource the process, they will also check for the number of certified coders in that particular organization. Okay, friends, now if you're watching this on podcast, if you want to see the text, you have to search in YouTube as Joel John J and find and select my photo, then go to the playlist tab and look for this medical coding videos by Joel John J playlist, or also you can try texting as medical coding videos by Joel John J on the YouTube search box, or you can search by Joel John J and move to this playlist. So now getting into the video topic, and I have added my channel name Joel John J YouTube channel, and the playlist name is here, medical coding videos by Joel John J. For you, if you are searching on looking at this video alone, I will give it on the end of the video. You will get this playlist on the end screen, and few other important playlists will be there. Click on that and watch all the videos for a good understanding. And now we are going to get into this video. Okay, medical coding services. This is going to be an introduction. What is medical coding? The first thing we have to understand, medical coding is the process of taking a patient's healthcare information like medical procedures, diagnosis, necessary medical equipments, and medical service information from the physician notes. A medical coder transforms this information into universal medical alphanumeric codes. Medical coding is the process of using universal alphanumeric codes for healthcare services rendered. That is, whatever the healthcare services which are provided to the particular patient, and the doctor conversation will be recorded on a phone or using some recording device and sent to the medical transcription team. They will document it, all the necessary medical things, they will document it, and they will send that document of office visit particulars to the medical coding team. Also, they will get the diagnostic reports, lab reports, and whatever the services they get, the equipments they get, every details of the patient will be sent to this medical coding team via cloud or PMS software, that's practice management software, which the doctor office use, and access will be given to this medical coding team. So these people will be changing this code, these services into codes for easy understanding and updating on the software, so that all the future process will get automated. So that's the main purpose. Okay. Uh, so the medical coding is the process of using universal alphanumeric codes for healthcare services rendered, that is, medical diagnosis, procedures, services, and equipments provided. A patient's medical record, that is, documents such as physician notes, laboratory reports, and service list, are used by medical coders to add medical codes, and medical codes add the corresponding diagnostic, and medical coders add the corresponding diagnostics code. That's the diagnostics code is ICD. codes are called as diagnostic codes, and the current version is 10. The procedure codes. Procedure code stands for CPT codes. Okay. The process of medical coding involves abstraction of medical information from the available documents, assigning the right diagnostic codes, that's ICD-10 codes, and procedure codes, CPT codes, and enabling the process of the charge entry team to create the claim form and submit it to the payer. The payer will be the insurance company in the form of claim form. That will be UB04 for facility and hospital charges, and CMS 1500 for healthcare providers charges. Because when you get the rejections, they will be rejecting the particular CPT code, okay, or the revenue code in case of UB04 form. Then for the, if there is a revenue code, there will be a corresponding CPT codes for that. Or if it's a fees denial, you have the, for what ICD-10 code the fees has been done. So that ICD-10 code may have a correction. So those things will come as denials for you. Okay. Payers, insurance company can understand the following information from the standardized codes. Patient diagnosis, that's ICD-10 codes. Medical necessity for the treatment, services and supplies the patients received. And these medical necessity will be given by the NCD and LCD guidelines, which are given by Medicare. So those things will be taken care by the denial management team, and also modifier, whether they can do this with a modifier. Okay. All those things will be given by the NCCI edit sheets will give the information whether this ICD-10 code and CPT code are inconsistent with, or else will be inconsistent with the modifier. So those are the things which are how the diagnostic part happens. So to give you a additional knowledge. Okay. Accurate medical coding can reduce claim denials. High quality medical coding is essential for accurate reimbursement from the payer, that's insurance company. Medical coding errors results in claim denial, besides creating unwanted compliance issue, which leads to additional expenses for denial management resources. That's when you do an error, the insurance company has a claim adjudication team to whom the claim forms will be forwarded. They will check whether it's medical necessary, or if there is any mistake in the ICD-10 code and the CPT code you do and careless mistake, that will be denied as medically not necessary, or CPT code inconsistent with the procedure. Like that, there are a lot of denials. When they denied, what happens is the AR team also does the claim follow-up to check whether the claim is submitted, whether the claim is received, and is it because they should not, there is something called as timely filing limit. After that, the company won't pay for the insurance company won't reimburse. Then you have to go for appeal, and there are a lot of procedures which again requires a lot of cost. So these, if they just check for the claim turnaround time, and if everything goes on, if everything in the claim is correct, then there is no problem. If there is a coding error, then because to resolve the coding error, there will be a lot of additional costs. That's what we are going to check now, which leads to additional expenses for the denial management resources. So they need to have an AR callers, and some companies also have an AR analyst, and this they are will be on a part of denial management team. And then again, this for the correcting the coding errors and resubmission of the claim form by the charge entry team, and delay when the issue cannot be resolved, it leads to provider write-off, which is a loss for the healthcare provider. That's what I said earlier. So when the timely filing limit is missed because of this, then provider will be in a situation to write off the claim, even if you cannot go for appeal for that case as per the insurance plan. Those will be a loss, right? Provider write-off means the provider is not going to charge for this, cannot get it reimbursed from the insurance company, and as per the terms and conditions, he cannot charge it to the patient as well, because the mistake is on the provider side. So that time it becomes a loss for your client. So definitely then he will look for an alternative, right? So that's a very bad thing which you shouldn't let to happen. Okay, so there are commonly there are 7 steps in the medical coding process flow. Let's review the header of the report. Review the CPT code book starting in the index. So you have to review the CPT code book. As you have gone expertise when you become a senior level person, and now there are a lot of softwares to help you on that. So you can just type and check it out. And when you do it with the Excel sheet, you know, even if you don't save the Excel sheet proper, if you don't make it read only, or if you do a Control D or some mistakes on that, or if you type something on that and then save it, when you close it in an urgency, that's all, it's gone. Then the errors will be repeated. So always follow the use some standard softwares, and if you use Excel sheet, make it read only, then use it properly, take enough care. So the code, referring the code book is very essential. review the reports and documents, make preliminary coding selection, review the guidelines for the preliminary codes. So after doing the selection, you have to review the guidelines again. That's rechecking, because it's a very, very important thing. The success of a claim, it mainly depends on medical coding. Okay. Review policy and eliminate extra errors. If there is any need for modification, that's why I said about the NCCA edit sheets. That will give you the information about the whether the ICD-10 code is inconsistent with the CPT codes. And so in some cases, it says that for this, you need to get a modifier. When you need a modifier, you should check the doctor notes. If it's not having the instruction for modifiers, you have to ask for the progressive note from the doctor, and then only you can you can add the modifier. So all those things you will get to know on the training. Okay, you have to start about the training, and you also said about the certificate. Can I get any certificate? Any certificate is valid. There are 2 certificates which are mostly valid, because most of the companies, if they just test your knowledge and take you. And some cases, even non-life science graduate, they get these certificates from small institute and they try a lot, but mostly they don't take. In some cases, if the particular institute is having a good tie-up with the recruiters, they may place you. But still, if you want to get placed on any company, these 2 certificates are the most valid, because these are given by American institutes, and these are the standard institutes in America as well for giving this certification. The first one is AACP, that stands for American Academy of Professional Coders, Certified Medical Coder. And the next one is given by AHIMA. AHIMA stands for the American Health Information Management Association, and these also gives Certified Medical Coders. Okay. What are the certificates which are most common? Or CPC, Certified Professional Coders, and its variants such as CPCH and CPCI. CPCH stands for Certified Professional Coders Hospital, and CPCI stands for Certified Professional Coders Instructor level. Okay. And another one is CCS, which stands for Certified Coding Specialist. Then some of the examples of medical coding services, which are ICD-10 PM. ICD-10 PM stands for prenatal mortality. That's given by this. And CPT. CPT stands for current procedure terminology. So for testing your knowledge for freshers, they may ask about these kinds of full forms for this abbreviation. CPT stands for current procedure terminology. HCPCS coding, Healthcare Common Procedure Coding System. I repeat, HCPCS coding stands for Healthcare Common Procedure Coding System. And ICD-10 PCS coding. This is for ICD-10 Procedure Coding System. Chart audits and code reviews. And HCC coding. HCC coding stands for Hierarchical Condition Coding, Condition Category Coding. HCC coding stands for Hierarchical Condition Category Coding. This was implemented by the Center of Medicare and Medicaid Services, which is given by CMS in the year 2004, and it helps to estimate the healthcare cost. So this is something which is very different type of coding system, wherein based on the patient history, for each patient there will be a patient history and his age and the demographic he lives. Before providing the insurance itself, they calculate a cost. This is now being done on commercial insurance as well. Commercial insurance as well hire a lot of coders. This is a place where the coding team works for the insurance company. Once they get the details of the patient, they send it for commercial coding. There are some kind of EPO plans, they will call it as, which are exclusive provider plans. And also these plans are provider organization. That's the exclusive provider organization is the full form for EPO plan. And also there are some other plans also, they do this study when they give a insurance, and for corporate insurance on highly hazardous in the industries, they do this HCC coding to evaluate. And also for people of higher age category, they do this coding and evaluate how much cost the insurance company will acquire. So these coders work for the insurance company itself. Okay. So they will estimate the approximate cost, health cost, how much this person may spend for his health condition, and average out. Based on that, they also arrive at the premium which they charge for the insurance. And another one thing which is happening is offshore coding audits, payer specific coding requirements. These are all the things which are part of the coding team. General processing method of medical coding team. The medical coding team, as per available clinical documents, in line with the process defined by our customer. Medical billing wholesalers or the facility or the providers will be the customers through detailed work instructions. So the coders also should be aware of this detailed coding instruction given by their particular client. Okay. The work performed by the medical coders is reviewed by knowledgeable coding auditor who has the request experience and the certification. So mainly the audit level people will have certification and also will have enough experience. Okay. Medical coding audit services. Medical coding audit team audits all the coding work done by the medical coders. Also US clients, healthcare providers and facilities for their in-house coding. Often reach out to medical coding companies to perform. Often the offshore medical coding companies also request this to perform the medical billing audit of the coding done by their team members in their in-house medical coding team. So what they do is, if there is coming up as a new hospital or if it's coming as a new coding company, they will hire some experienced coders from a different company, and these coders will be just doing the audit for the works done by other coders. So if they don't have enough certified people and if they don't have enough senior people in their team, having experienced medical coding auditors improve consistency with the laid down procedures and eliminates the risk of coding errors. Medical coding and denial management. So with the denial management perspective, that's the reworks which comes in how we are going to do. When the accounts receivable team comes with the denial happened because of incorrect coding, the medical coding team also performs a coding related denial analysis. If found as incorrect coding, corrects it and sends it to the charge entry team to resubmit the claim backs to the payer to get the denied code claim reimbursement. From whom they get the reworks? They get it from the denial management team, and they will just send it as resubmit the claim form. And if the claim form is if the resubmission is for the incorrect coding, then it will come to the coding team, and then again they will do the correction in the coding and send it to the charge entry team. The charge entry team will again change this in the software as well as, and then create a new claim form. And this is repetition process needs a additional workforce cost. So that's why I said that coding is much important. This will lead to additional cost. Coding training requirements. So how the coding training requirements for a coding team, or for freshers you will be getting an understanding, and for senior people as well, check whether you get all these. Okay. Medical coding needs a very comprehensive coding training process. Each coder deployed on the customer account should be thoroughly trained and go through ongoing refresher training. So also a refresher training is essential. That's why I said, for experienced people also training is required. Hiring of coders with experience or fresh graduates from life science background. Why they are hiring people from life science background? Because they have knowledge on human anatomy, that's study of cells, tissues and organs, and human physiology. Physiology is the study of human bodily part functions. So you should, if you are a fresher in life science graduate and if you are going for an interview, these two topics, human anatomy and human physiology, is something you have to study again. Okay. And also get some knowledge about the diagnostics which are being performed, CT scan and all those. Search it on Google and gain some understanding about that. Okay. And also about the various diseases. Common diseases. What are the common kidney diseases, liver diseases, diabetic patient care, like that. Get some understanding on that. Foundation training on revenue cycle fundamentals. I said, denials also will come to you. So that you should also give a knowledge about fundamentals. Main thing is like you get the denials from I would have already explained you how the flow happens, or else I have a separate video for RCM process. Watch that as well. Okay. On the job training based on the job training based on the quality of the coding delivered and the individual specific feedback. So when they find out an error, they should also call the individual and check out how the error happened. It's a careless mistake or what's the reason for the error. And then if the person is not having enough knowledge, then they have to give him a retraining, or they have to ask him to specifically go through the notes wherever he is lagging behind. And also outside also they have to ask some questions whether he is completely not on processing level. Then they have to give him a complete refresher training. Certification training for non-certified coders. This is something which is very good about this industry. What they do is, even if they hire as a fresher or if you experience and you don't have a certificate, they will give some discounted fee for certification, appearing for the certification exam, and also give a training at a discounted cost, as they also are much in need of certified coders. So you get an opportunity. There may be bonds and other conditions or payment of some amount of fee. Check with the market conditions around. And if you're going to stay in the industry, it's really good for you to get certified, as it's universally valid. I told you the 2 certificates earlier, right? So check that whether they are giving that certificate. If that's the case, don't miss it, because that's universally valid. Okay. Auditing of medical coding. Get medical records from the EHR or PMS system. EHR or PMS is the software terms which they use for the software in which they work for medical coding, as well as the clients will have the same software from where you get the node. Systems via a secure connection or a cloud. Check, validate, and the correctness of the information. Review the records and assign the CPT and ICD code information. Audit of the code chart by the quality analyst. Sending the completion report to the customer, then it gets transferred to the charge entry team for claim form correction. So this is how the chain works. So now we are going to look at some of the frequently asked questions. What are the 3 main types of coding? So these are the 3 main types of coding which are mostly done. CPT stands for current procedure terminology coding, and ICD stands for International Classification of Diseases, and now the current version is ICD-10. HCPCS, that stands for Healthcare Common Procedural Coding System. Write down this, and this is a very important thing for freshers. Even they expect to have some knowledge about medical billing, medical coding. If you are at an experience, definitely in this field, even 6 months is considered as an experience, but they will definitely expect you to know at least these definitions. Okay. And now, what is HCPCS codes used for? The Healthcare Common Procedure Coding System, HCPCS, is a collection of codes that represents procedures, supplies, products, and services that may be provided by the Medicare beneficiaries and to individuals enrolled in private. That's private insurance will be called as commercial health insurance program. So private insurance means it's mostly called as commercial insurance in US. So be aware of this term as well as they use the term payer, because they are going to pay for the patient's medical procedures done. Okay. How many types of HCPCS codes are there? Healthcare Common Procedure Coding System, HCPCS, is a standardized code system necessary for medical procedures to submit healthcare claims to Medicare and other health insurance in a consistent and orderly manner. HCPCS includes 2 medical coding sets. One is HCPCS level 1 and another one is HCPCS level 2. So what are these? That's coming on the next question. What is HCPCS level 1 and level 2? HCPCS level 1 stands for CPT 4 codes. Does not include, note this, for medical item services that are regularly billed by the supplier. These are regularly billed other than the physician. Whatever the physician bills are not included in the level 1 HCPCS coding, but they are included in the HCPCS level 2. Level 2 of HCPCS is used primarily to identify products, supplies, and services that are not identified on CPT-4 codes. So these, if it's not on CPT-4 codes, then those are identified on level 2 codes. What are the examples of that? Ambulance services, that won't be there, right? And another one thing is durable medical equipment, etc. So durable medical equipments, if physician prescribes and if it's on the CPT-4 codes, then go by that. Okay. What are the difference between CPT and HCPCS coding? HCPCS codings are for basic health services like medical devices, medical supplies, etc. These codes provides a standard description for the services. So services, it is HCPCS. And what are all those for? Medical devices and medical supplies. CPT codes are for services like surgeries, diagnostic test, evaluation, and management services, and that's in short called as ENM CPT coding. This is the kind of vacancy you'll see in Naukri as well. EM and CPT coders for ENM required. That's for CPT coders for evaluation and management services required. So now you will be very well being understood, right? So this HCPCS codes are for medical devices and supplies, and level 1 is for which are regular supplies. That's like CPT-4 codes. These are called the CPT-4 codes. And if and these are not done by the other than what the physician prescribes. And level 2 is for which are not identified, for products and supplies and services which are not identified on CPT-4 codes. Then what for CPT-4 codes are? CPT code for codes, only codes are for, not CPT4 codes. CPT codes are for services like surgeries, diagnostic tests, evaluation and management services. That's E&M services, E&M coding services, etc. E&M CPT coding services, etc. To be more accurate. So what is CMS code then? There is also a code called a CMS. What is that? Place of service code, POS. This is a 2-digit code placed on the healthcare professional claim to indicate the setting in which the services were provided. The Center of Medicare and Medicaid Services, CMS, maintains the POS codes. That's place of service codes used throughout the healthcare industry. So throughout the healthcare industry, to know where the place of services is, where the service is taking place, the CMS has given a code called as POS codes, which is called as place of service. POS stands for place of service in US medical billing. So you have to be very careful on that, because this is also a question they ask, because sometimes they will say that the CPT code is not inconsistent with the place of service. This error also will come to the coding team. So for senior people, they will expect you to know about the POS stands for place of service. Okay. So, okay, fine friends. With this, we come to the end of this video. Hope all of you would have got a good understanding about the basics of coding. This is just an intro video, and I will be giving only intro videos on medical coding, because even I don't know about coding, and I am also not a certified coder, and I'm not a coder itself. Okay. So as part of we are creating interview preparation videos for many, and many of them looking at my other videos asked me, tell something about coding, bro, because we just want to know what is coding, because most of them what they do is this AR callers and analysts and people who work on other sectors, they think that medical coding is done for the denial codes which they are getting. That's denial codes. That's for ANSIC denial codes. Or I would have talked about that on the payment posting video itself. Those are given by insurance company claim adjudication team. That's not medical coders should have a knowledge about this, but that's not all about, that's not what the medical coders do. Medical coders give ICD-10 and CPT codes mainly, and ICC coding is a new upcoming one. That's the only thing they do for the insurance company. All the others they do for the work on the provider side. Okay, so there may be also few more which are working for the provider side. If you know any, comment below. If you have questions, also comment below, and press the thumbs up icon on this video, and share this video with your friends and have a discussion about this, and also about the denial coding errors. I will soon make a video on that, and I will try to explain the fundamentals alone. So don't confuse the denial codes with the uh, medical coding, CPT and ICD code. Denial codes will be common denial codes, CO codes and remarks codes, RM codes, which you get. Okay friends, it's time to say bye and watch all my videos. I have also a lot of fish and animal videos for relaxation. Watch that as well, and for if you have kids, also share it with them, and share this video maximum with your friends, and start speaking about this video so that you get a thorough knowledge on that. If you're watching on podcast, search as Joel John J in YouTube search box and find my video, and go to this medical coding playlist, or whatever the videos you want. Stay tuned to my channel, and press the thumbs up, subscribe, share, and also ask your friends to subscribe, share, and thumbs up. Okay, friends, it's time to say bye. It's your Joel John G signing off from you. Bye bye.